Hello, testing, testing. Hello, testing, testing. Good morning. Today is Saturday, October 23rd, 2021. Today's session is a special session. This session will be called Ayurvedic Yoga Therapy. This is a part of yoga teachers training program of the Zenya Yoga Academy, and today I'm not in my home in Norfolk. I'm in Maryland in my daughter's home, and I'm presenting from my daughter's home. Today's topic will be Ayurvedic Yoga Therapy. We'll explain the concepts of Ayurvedic Yoga Therapy. Then we'll be showing the practices. As you all know, and I told you repeatedly, and we have more students today, so I can explain to you that you are all going to learning yoga. You're going to be a yoga teacher. Yoga basically is an anglicized version of the word called yog. And the language the yoga is written is called Sanskrit. In the Sanskrit, it means union of your body, mind, and spirit. It's a philosophy. It's called Yoga Sutra of Patanjali. It's 196 aphorisms, of which 193 is to quiet down your mind. It's a practice called 8-limb practice, called Patanjali Ashtang Yoga. Ashtang means 8 limbs. And you as a student or yoga teacher, you have to memorize the names, both Sanskrit and English names. First one is Yam, which is a social restraint. There's a Niyam, which is a personal restraint. Third one is the Asana, which is the external and internal alignment and a relaxation response. Fourth one is a Pranayama, which is a voluntary regulated breathing. Fifth one is a Pratyahara. Pratyahara means reject, Ahara means input. All the inputs, so through my 5 senses, learn how to control your 5 senses. Sixth one is Dharan, which is the focus. Seventh one is a Dhyan, the meditation. So meditation basically is the 7th limb of yoga practice. Final limb is called Samadhi, which is a union of your body, mind, and spirit. Yoga as a therapy is the adaptation of the yoga practices based on the patient's clinical condition. That means we are not inventing anything, or we are not reinventing anything. We are using the same philosophy, same practices based on the patient's clinical condition. Number 2, yoga as a therapy is not a reductionist This is called holistic. What does it mean? Holistic means, actually holistic means, I always say that somebody forget to put the W in front. Holistic means whole. So what yoga therapy says, in fact, the father of our modern medicine, Hippocrates said, I am not interested about the disease a person has. I'm interested about the person who has the disease. Remember, disease, dis-ease, D-I-S space E-A-S-E. Sanskrit is called ashuk. When is becomes dis, it becomes a dis-ease, and therapy is a effortless ease. So yoga therapy also is not interested about the disease you have. I'm interested about the person who has the disease. And what we know from a traditional system of healing, that every person has their psychophysical body type. And this psychophysical body type basically is the body's energy. So what does it mean? When you consume your food, the food after proper digestion, which we'll talk about later today with the students, the food basically converts into an energy. So what is an energy? A simple 8th grade chemistry. The glucose, which is the end product of metabolism, combines with the oxygen, which is called aerobic glycolysis, produces carbon dioxide, which is water, and the energy, which is called ATP, adenosine triphosphate. These energies are of 3 types. One is a catabolic energy, which starts breaking down your body. Another is a metabolic energy, which starts maintaining your body. Third one is called anabolic energy, which starts building block of your body. This energy represents or gives a different psychophysical attributes, which in Sanskrit, in Ayurveda, are called guna. In Ayurveda, what is Ayurveda? The word Ayurveda comes from Ayu, means your longevity. Veda is a knowledge. Knowledge which gives us the longevity. Ayurveda is a philosophy. It is a beyond science, but this is a science called a transcendental science. It's a science beyond science. Ayurvedic philosophy is that our body is a part of the universe. Balance between body and universe is a health. Imbalance between the body and the universe is a ill health. Universe is made of 5 elements. There is no Big Bang theory. First, there was a space in the universe. In the space came air. Air had a friction, caused fire. Fire melted the cloud from water. Water froze into called earth or the ground. So the universe is made of space, air, fire, water, earth. On the same philosophical concept, our body also have those 5 elements. Space, you can think about spaces in between our stomach, space in the lungs, space in the colon, space in our body. And also in the mind also. Air is a movement. movement of my intestine, movement of my heart, movement of my muscle fibers. That's the air component. Fire is my digestive fire, digestive power. All the digestion takes place because the fire within me. Fire is also the vision. I see because of my fire within me. Water, our whole body, is made of water. 70-75% or whatever percent you can think body is water. Water also holds the tissues together like a dough. And earth is the grounding element, like your bones and joints or teeth. And these 5 elements are represented in our body and mind in different proportion. Person who has a more attributes of space and air, they are called vata. There is no corresponding English word, so called vata. So vata has the attributes, or we call it the gunas, attributable gunas of the space and air. The most important attribute is a mobile. They're very mobile. They're very light. They're very dry. So being mobile, what happens, you can see, and you always see, somebody physically, they cannot sit down in one place. They're always moving around, doing these things, continuously talking. The vata predominant people. Mentally, yes, mentally they will start doing, 10 different things at the same time, but never done. They're very creative. They're very busy. Always they're busy doing something. But when the vata got out of balance, or remember the balance of, these are called doshas. The balance of these doshas keeps our body, mind healthy. When the imbalance, the primary thing became anxiety. We're very anxious. So we'll show you the practices, we'll show you the sites for vata. Vata resides in the colon. Vata has the energy of a catabolic energy that's been breaking down. So vata is always mobile. They're always, they're always busy. If you send them an email, you'll get a reply email right away because the mind is always mobile. You need to balance with a grounding practice. They will need the grounding asanas. They will need to balance both sides of the body through the pranayama practice. And they also need a guided meditation. When we do a practice, we'll go over with it slowly and slowly. The people who have a more fire and water, they call it Pitta. The Pitta has the attributes of fire. They're fiery. They're hot. They're very determined. They are very controlling. They feel like they're the best of the best. They're the king and queen. You cannot talk to them. You cannot guide them. Their word is the final word. They're fiery company. You can see this person is fiery. But they're very driven. You have to have a Pitta to be a surgeon, to be a very precise worker. And our body has all the components. So when you look at a vata person is very thin. They never gain any weight. They're very mobile. And they're always talking. But interestingly, these people get primarily the disease of the musculoskeletal disorders and neuropsychiatric disorders. All the nervous disease, psychiatric disease, back pain, knee pain, hip pain, all the neurological disorder, it happens primarily with them. Pitta, on the other hand, who are fiery, who are driven, and when they go out of imbalance, they become very angry. Anger is the primary imbalance. They get the disease, most of the inflammatory disease. And the inflammatory disease is a Pitta-related disorder. They get the disease of the liver, small intestine, and your heart. They reside in your small intestine. This energy. This is a metabolic energy. So all the practices which centered around your umbilicus, your belly button, you will see, I will show it to you, all the asanas. You do a Nokasana, boat pose, or you do a Janushirasana, head touching your knee. I'll show it to the asanas so you'll understand. So they're very hot. They have to do cooling practices. They have to do cooling pranayama, like a left nostril breathing, Chandra Vedhi Pranayama, which is cooling. They will do Sitali Pranayama, cooling pranayama, Sitkari Pranayama. On the other hand, Vata will do, primarily Vata will do, because they're in imbalance and moving both sides of the body, is your alternate nostril breathing, Anulom Vilom Pranayama. Yoga says the health is simply a balance of your body, mind, and spirit. We're in imbalance because either I'm right-handed, you are left-handed, you're using one side of the brain, you're not using other side of the brain. So when you do it equal, you will see when you do the practice, we'll do the equal practice on both sides of our brain. I'm right-handed, I'm always with my left hand. I brush with my left hand, I shave with my left hand, I'm wiping, I'm cleaning, I mean, before it was so cumbersome, but now I'm very comfortable with my left hand. I do equally, tree pose on both the feet. And when you are in imbalance, you'll see your one foot standing, one side is better than the other. I'm going to show it to the practice. Vata is very cooling. So they will need some warming asanas, warming practice also. A primary asana which is in our yoga is the sun salutation. Sun salutation, Vata will be doing very slowly. Vata always, mobile, looking all over, doing like this. So they will have the gauge down. You teach them to how to get gauge down. Teach them how to do all the asanas very slowly and stay in the pose. Otherwise, they'll go in and out of the asanas. They're very flexible, so they will go overboard. You don't want them. You want them to do it very slowly. Pitta is a heart, so counteract the heart, you will do a moon salutation, Chandra Namaskar. And you'll also do the focus within them, because see, Pitta thinks they're the queen, they're the king. Who are you to tell me? They're very driven, they're very focused, so if you let them focus, they will focus better. If we tell them to do a tree pose, they will do a lot better tree pose than any of us. So you have to let them go. Hot. They will do asana practice or whole yoga practice, cooling practices. Focus, so they're diffusive, dull. They're very controlling, so this is forgiving. Forgiving, relaxing, surrendering. Those are the attributes to balance Pitta. On the other hand, Vata will be your calming, consistency, grounding, slow, steady, strengthening. Opposite what Ayurvedic yoga therapy says, you have to do the opposite of your attributes of your doshas, the psychophysical body type. It's called the law of balance. If Vata is mobile, Vata is dry, Vata is cooling, they will do the practice, grounding practice. They will be doing heating practices. They will do some practices which will be your hydrating practice. Kapha is a third one, which is the primarily is your water and earth, but they're basically grounding because earth is very grounding. So these people don't move around, don't turn around. I said, we tell them, oh, these are lazy guy, lazy person sitting down. They will need, push, pull to do all the work. Pitta is so controlling, Pitta is so dominant. It's like if you send an email to a Pitta, Pitta will read the email about 5 times, analyze every sentence, every word, then will send you a nasty email back. Why nasty email? Because they're the Pitta, they're the king and queen. Who are you to tell them what to do? Kapha, the primarily attribute of the Kapha is grounding. They're all grounded. But on the other hand, what they have, they're very well contented. But they're very dependable. Dependable means, see, a Kapha person, okay, if you go to a Vata person, you will see they will have 10 different projects they're starting, nothing is done. Pitta will have one project, totally done. All the clothes are in color coded, in proper, all the shoes are in a rack, everything in order in their life. They're called metabolic energy, because the heat comes from. Since Vata is a catabolic energy, Pitta is a metabolic energy. Kapha is the building block that is an anabolic energy. Kapha, like I say, Kapha people are rounded. It's not the fat, obesity. Their body, the wrist is very nice and rounded. And also in a lifetime, the young life is a Kapha type. Middle life is a Pitta time. And the senior people like us, we're in the Vata time of our life. This Vata, Pitta, and Kapha is everywhere. This is in the universe. In fact, balance between universe and us is a health. It's called Yatha Pindo Tatha Brahmando. Pindo is the microcosm, my body. Brahmando is the macrocosm. So what the Vata will need to balance, Kapha will need to balance, that they'll need something challenging. They'll need something drying. But Kapha is also very wet because of water content, drying. They're very heavy. They need some practice which is a lightening practice. They're grounding at less than one place. They need something moving. So their sun salutation for the Kapha will do a very rapid sun salutation. Pitta will do a moon salutation. Kapha will do a rapid sun salutation. Vata will be very slow, rhythmic. sun salutation. Since Pitta doesn't care anybody, but Pitta cares about themselves. So for Pitta, the focus will be within them. Focus will be called introspection. Focus will be looking inside yourself. So when I do a Pitta practice, I say, look at your heart. Look at yourself. Kapha, on the other hand, grounding, their head will be down, face will be down. So Kapha people, get your head up. Look up, do little challenging, faster, moving, stimulating, warming. These are the attributes of the practice. Same way, when you will do the pranayama, as I said, the Pitta will do your left nostril breathing, Chandra Vedhi Pranayama, Sitali Pranayama, Sitkari Pranayama. Kapha will do very rapid Kapalbhati Pranayama. I'll do your Uddiyani Bandh, Abdominal Lock. They will do your Agnisar Kriya. When they do the Bastrika Pranayama, they will do very fast Bastrika Pranayama. Pitta will do a Bastrika Pranayama, very eyes closed, very centered towards the heart. Vata will do Bastrika Pranayama very slowly and in a rhythm. Same way in the meditation, Vata will need, because the mind is mobile, Vata will need a focus and guided meditation. Most important Vata meditation will be breath-centered meditation. That means you'll be following your breath to do the meditation. Or you'll be doing a chanting. We call it a mantra. Mantra is a vibration. Brain has a vibration. Two vibration interacts, cancels, and quiets down the mind. It's called mantra meditation. Pitta will do the meditation with a focus towards inner self. We call it empty bowl meditation with the cable kumbhak. They will do close down their eyes when they're meditating. They'll be meditating with their breath following as if their guide is their inner self. Kapha, on the other hand, will need a moving meditation. Kapha will need a very slow, we call it a west rotation. Kati Chakra Asana as a meditation. They'll be doing a walking meditation. And the walking, that is the meditation. They will do like a tratak, jyoti tratak, like you light a flame, you look at it without blinking your eyes, and you are in a meditative state. Remember, in a meditation, what happens? Normally, we have a thoughts after thoughts after thoughts. We generate thoughts in our mind. In a daytime, we generate thousands and thousands of thoughts. Interestingly, most of the thoughts are in the past, some thoughts in the future, very little in the present. Also, even in the present thoughts, a highest number, maybe 95, 98, I don't know the exact number, are the repeat thought process. Yeah, I have to, even before sleep last night, I have to start a class tomorrow. There will be some students. I have to teach Ayurvedic Yoga Therapy. It keeps on coming and repeating. It's called the monkey inside my mind. In a meditation, you enter in between the thought process. Slowly and slowly starts increasing the gap between the thought process. And you are in a state of same thought process, but they're not repeating, they're not coming back. You never become thoughtless. And also in present day computer language, my body is a hardware, mind is a software, spirit is a programmer. Who is the programmer? I am the programmer. I program my software, my mind, so my hardware get fixed. Excuse me. So, yeah, we do a Jalneti every morning. This is our yogic daily routine. And you do have a little bit of a drainage comes throughout the whole day in your nostril, which is entirely normal. Okay, so think about asana practice for a Vata person. Very simple and best way for the students to remember. Any asanas below your belly button, grounding, like here I am, I'm sitting down with my cross-legged. This is called Sukhasana. What I do, I stay here, both my feet, put under both the knees, and keep my spine straight. I need to create a relaxation response. When you have a relaxation response, then you progress slowly. Yoga therapy is the starting your practice where you are. Non-competitive, you're not competing with anybody, and you listen to your two-body signal. First is pain. Come to here, you get a pain, you back off. You find a place where you don't have any pain, but you stay in the pose. Next, you follow your breath. Your breath has to be completely effortless. If you have any effort in breath, so back off more. And you'll see it's very obvious when you do some spinal twist and other practices, it is very obvious. When you stay in a pose with your spine straight, eyes closed, with the hand mudras, this is very important. Hand connects your body and mind. So this is a mudra. We have a whole section about mudra as a therapy. You can go ahead and look at it. Touch your index finger and thumb. This basically we call a index finger represents air, thumb represents fire. Air and fire component, and your mind quiets down. When you keep your spine straight, all the muscles in the back, which was keeping your spine straight, are going to relax, and you enter into a profound level of relaxation. Muscle cannot stay contracted too long. If you stay long enough, not long, too much, 30 seconds, a minute, you will develop a relaxation of the muscles. Before relaxation, it causes a little twitching. It's called a sthiti, stability. Arambho is the beginning of an asana. Sthiti is your stability. Then you get a profound relaxation, which is called your Visarjan. It is the activation of parasympathetic tone. Parasympathetic tone is called calm and digest. First sign is a saliva in your mouth. When you get a saliva in your mouth, that means you're having a parasympathetic activation. When you have a sympathetic overdrive, like what is called a stress is sympathetic overdrive, you get a dry mouth. When you get fear, you get a mouth becomes dry. Here it is, I'm talking to you over half an hour, and my mouth is very wet. So when you are comfortable like this, what the next thing you do, you change your feet because you need to create the balance. All grounding practice, balancing practice for the vata below the belly button. So once you're comfortable here, it will take your time, which is called a neuroplasticity. Neuroplasticity means we call a habit forming. Generally, it needs about 30 to 40 inputs for neuroplasticity to set in. See, I'm sitting like this. I'm not trying. My brain is allowing me to sit like this because I've sat down this multiple times in the past. Brain got a signal and brain knows I would be able to sit like this. When neuroplasticity sets in, you go to the next thing. It's called a Siddhasana. Take the heel all the way to the back. Put your one foot in the top. Your knees drop down. You don't push it down. If the knee is here, let it be here. Close your eyes, do your breathing. Most important breathing is lung is like a balloon. It has 6-liter capacity. It needs 1.5 liter to stay open. You can exchange 4.5 liter of air through your deep breathing. Normally in a tidal volume, we only breathe 500 cc. So you have about 80 to 90% reserve in your lung. You learn how to breathe out first. Slowly take a deep breath in. Breathe out longer than breathing in. Without any effort. For you, maybe 2 seconds in, 4 seconds out. For me, it will be 4 seconds in, 10 seconds out. I'm very comfortable. What happens to the breathing, the muscles of the breathing, these are called skeletal muscles. Muscles are trainable. Like here it is a, gym, we have multiple weights here. I can do 10 pounds. Within a few weeks, I'll be able to do 12 pounds, 15 pounds, 20 pounds, 25 pounds, because my muscle can be trained. Same way my breath can be trained. 3 seconds in, 6 seconds out, 6 seconds in, 12 seconds out. We've been doing it for so long, we do very easily. 8 seconds in, 16 seconds out, 10 seconds in, 20 seconds out. Let me show you one time so you understand what I'm talking about. Breathe out first. Eight seconds in. 16 seconds out. Very easily. I had no effort, nothing, but it took me a long time to practice. So I'm comfortable like this. Now what I do, I go back, put the other Siddhasana. My heel is in my perineum, my other foot is here, the foot drops down. So to keep on practicing here in slowly in a grounding, what you'll do, you'll come back next, what is called your half lotus, Ardha Padmasan or Swastika Asana. Again, listen to your body signal. If it hurts here, causes pain, back off. Find a place where you don't have any pain, where you have your effortless breathing. Even if it hurts here, put your finger here. Start somewhere. People come and tell me, well, I have a knee pain, hip pain, back pain. I'm 75, I'm 85. Who cares? Listen to your body's signal. Don't compete with anybody. All the asanas are your guide. But you do this and see how you feel. That's yoga as a therapy. I'm here, I'm very comfortable. I'm talking. I'm singing. That's my effortless breathing. So I'm comfortable with a Ardha Padmasana, half lotus, go to the other side and form a heart lotus. I have my sole and right knee. I have a lot of problem with my right knee. I have seen my orthopedic surgeon. I'll get all the imaging done. There is a little bit of changes. I have a pain. So my friend, he wants to give me a steroid injection. I said, I have a better steroid. Remember, these asanas are relaxing asanas. Pain comes from the tightness. Pain comes from the tightness of your ligaments, tightness of your muscles. Cartilage, instead of cartilage breaking down, cartilage doesn't have any pain fibers. Bone has some pain fibers inside in the bone marrow, maybe a little bit of periosteum. So more you get relaxed. I said, yes, I don't need a cortisone injection. What I need is my lotus pose. So I go back, put my feet high up. I sit down in a lotus pose. When I get into the lotus pose, say I got into in stages. So that was for the Vata balancing pose. Vata was mobile. Vata is not going to stay in one asana for too long because whole body and mind is mobile. So you have to bring them slowly in steps for Vata. Pitta, on the other hand, will go to the asana right away. You see all the yoga teachers, the Pitta yoga teachers, they will never take these steps. Boom, 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 they're on the lotus pose. They put one foot high up, another foot high up, lotus pose. But also I guide them, if you can do a lotus pose, then what you will do, for the balancing, you put the opposite foot first, and then you take the other foot and bring it up and do a lotus in the opposite side. This is a therapeutic yoga practice, not a reduction, but holistic, balancing both sides. I can do the lotus pose. This was my, what is it? Left foot up, left foot down, right foot up. Before I was doing right foot down, left foot up. So another, say Vata will be your grounding asana. Say Vajrasana, thunderbolt. So thunderbolt is a very relaxing asana. Thunderbolt is your parasympathetic. So people say, I have a hard time doing it. It's not the hard time doing it. You do in stages. You do in stages. Put your feet here. Maybe you put your, and then keep your spine straight. Slowly, you put your feet here. Now, if you have a problem here, it can be hurting, take a little roll, put it underneath your knee, underneath your ankles. If you have any problem sitting down, you can take a little bit of a pillow, put underneath your hips. But also, I like to get a folded blanket. The reason for folded blanket is that when you start developing that neuroplasticity, you can remove the layers of blanket, and you can come to a point where we are without any blanket. So, lotus pose, Padmasan, from in stages, called Sukhasana, easy pose, Siddhasana, perfect pose, Ardha Padmasan, half lotus to a lotus, keeping your spine straight, breathing out longer than breathing in. Vajrasana, your thunderbolt, also in stages, with a little support. And then a lot of other grounding poses you can do, but say you can do a yoga mudra, but you lay down. Lay down, you do one of the very famous pose for balancing vata is your knee chest, which is called actually Pawan Muktasan. Pavan is the air in the vata. Pavan is the vata, and that's a very famous asana for your vata. I have this yoga mat, and everybody's asking me about yoga mat. Where did I get it? It's my daughter. My daughter is an attorney, and she's a certified yoga teacher. A personal mat, and my wife is an artist. She's a professional artist. She did this artwork on her personal mat, and she was kind enough to let me use her personal mat. A lot of story behind it. It's a mother-daughter project, and she loves this yoga mat. She will never find it. A few people ask me, where did you get this mat? I said, please connect with my wife. Vata people cannot lay down. Vata people cannot keep your eyes closed. The people in the Vata people will be there laying down and moving. Kapha, on the other hand, they lay down, they close their eyes, and they're gone. So for the Kapha, you will be uplifting asanas. Kapha, you will do your asanas which use a large muscles, like say Gomukhasana, cow face, or you say Ardha Matsyendrayanasana, the spinal twist. So this is a famous asana for your Vata, which is your Pavan Mukta asana. So you lay down. Remember, when you're laying down for the Vata people, what you ask them to do, ask them to use a hand mudra. This is a hand mudra to quiet down your mind, touching index finger and the thumb. But if you do Adhi mudra, like putting a thumb inside and close your hand, this is called relaxing. This is the baby fist like this. When you put your head behind, be sure your chin is little down, not way high, not like this. If you do like this, put a little folded blanket underneath, because I always insist on a folded blanket, because once you start developing the neuroplasticity, the folded blanket can be removed very slowly. In a knee chest for the Vata, called Pavan Muktasan, you hold your feet and slowly bring it close to you, one foot, and then raise your head high up. See if you can touch your nose to the knee, and if you sometimes bring chin in front of your knee. Remember, health is a balance between body, mind, and spirit. So do the opposite side. Remember, you're doing it very slowly and in stages. Find it out where you are. Today you are here. Stay here. Stay here with your eyes closed. Stay here with your breathing out longer than breathing in. And when you keep it coming down, see, my head is also coming high up, and my nose is touching the knee, and then my chin is coming in front of my knee. Stay here a little bit and let go. Relax again. Hands down. close to your body, within 6 to 8 inches within your body. Palm facing high up. Then you go back with both the knees. Bend both the knees. Put your hands together. Slowly raise your body high up. Touch your nose to the knee. Then your chin goes in front of your knee. Then also you can do a little rolling, side to side rolling. This is Vata balancing pose. You also can do front and back. Go all the way to the back, to the front. Again, go back, because Vata likes to move. You want Vata to be in a Savasana. More you do Vata as a corpse pose, because Vata will be in a Savasana. Vata will be moving the hand, doing this thing, blinking their eyes. This is typical Vata people. Kapha, on the other hand, if you put them in the sun, Kapha is gone. Grounding poses below your belly button. Another very powerful asana is your Markatasana, monkey pose, or we call it a Jathar Parivartanasana. Put your hands on both sides like a T. Bend your both the knees. Drop both the knees on one side, like here I'm putting it on my right side, and then look in your left hand. Stay here in the pose, and you will see these are the poses the babies do. If you see a baby sleeping, even when the baby, you have a baby monitor, baby sleeping, many of the time, even in the sleep, the baby will be sleeping like this. Markadasana. In a yoga as a therapy, you try to stay here at least 5 to 10 breaths. And then you will be able to talk, able to sing, able to be totally effortless in breathing. Go back again in the opposite side. Put both the knees on the ground. Turn your head. Look towards your right hand. For Pitta, also the Vata, you will do a sun salutation in a very slow, in a rhythm. I'll show you when you stand up. For the Pitta, most important asana will be your asana focusing to your belly button. So think about the asana which is focusing on your belly button. because Pitta resides in a small intestine. Vata energy resides in the colon. Powerful asana to balance Pitta will be your boat pose, Noka asana. So slowly raise both the feet high up, get your body high up, and you are in a boat pose with the focus in your belly button. Initially, you'll have a lot of, we call it a fasciculation, and slowly it goes down. I'm showing you the asanas, but when I practice, I stay in the asana for a lot longer time. Maybe 5 to 10 breaths. Another asana here is a fish pose. And many times people say, I cannot do a fish pose, I cannot do. Very simply, I don't have anything here, but just take a pillow, put a pillow under your there. So here, what you'll do, you will get your whole body high up, see, and then drop your head down. Bridge pose, Satubandha asana, put your feet here. See, all the asanas you are doing, centering to your belly button. Slowly raise your body high up. Always try to do with the eyes closed. When you keep your eyes closed, you don't know, first of all, who is doing what next to you. Then you pay better attention to your breath. Eyes closed. Then slowly come down. So the Pitta people will do the asanas and the Asana Pranayama meditation practice, which has attributes of cooling, diffusive, dull, forgiving, gentle, relaxing, surrendering. Vata, on the other hand, will have a practice with attributes calm, consistency, grounding, slow, steady, strengthening. Kapha will do practice challenging, drying. Lightening, moving, stimulating, warming. So again, when you get up from a posture here, I mean, you have a lot of asanas, there's a lot of asanas you can think about, which are umbilical centered asanas, and also grounding. Grounding asana will be like your Sarvanga asana, Halasana. You can do Sarvanga asana very easily, go all the way back up, go all the way high up. You can even do a Padmasan and a Sarvanga asana. You do Lotus on a shoulder stand. And only way you can do it when you are relaxed. Very, very important. I'm showing it to you. You can go down as a cloud. Sorry. It's not that what asanas you can do, what asanas you want to practice. You learn how to relax your body and mind, it will come to you. Like say for a kapha is to do a asana using large number of muscles and a big muscles. So say Gomukhasana. So in a Gomukhasana, what you start, you first, my left knee will go on the top of my right knee. This is called a Vaisasana, which is a buffalo. If you look at a cow, the buffalo, they sit down like this. In fact, it's a cow face because it, metaphorically, it looks like a face of a cow. Left knee is high up. My left hand goes high up. My right hand comes into the back. I push my right hand. I take my left hand high up. I drop it. I hook it. I close it. I'm hand shaking each other. So look at that. My knees are relaxed. Ankle is relaxed. Hips are relaxed. My whole back, my whole upper part of the body is relaxed. Stay in the pose, doing my breathing, and relaxation sets in. Very good for people with balancing kapha dosha, kapha attributes. Balance it to the opposite side. Now my right hand is high up. Sorry, right knee is on the top of my left knee. Then you have to be balanced. Like see, when I'm putting my hands in the back, both sides I can do equally. For all of you who are practicing with me, you still see your one side is easier than the other side. Maybe I can turn around to show it to you so you'll understand what I'm talking about. I have my right knee in the top of my left knee. My right hand goes high up. Took my left hand. I may stabilize my left hand. Put it in the center. Right hand, put it down. I hook it. Slowly and slowly, I handshake each other. I'm comfortable, I'm talking, I'm breathing, I'm totally effortless. I'm still following my breath, and my both sides were equal. I have no problem with either side. On the same context, another one will be your equated both sides is your Ardha Matsyendrayanasana or a spinal twist. Very good for your kapha people. Bring my Right foot close to my left knee. And right hand goes to the back. Left hand goes first to the knee, goes to the ankle, goes to your foot. Breathe in and out. You will see breathing gets interrupted. Then try to look around right side. Do your breathing, and you'll see your breathing gets. If you have any effort in breathing, you back off. Ardha Matsyendrayanasana. There is no English translation. They call it a half Lord of the Fish pose. That doesn't mean anything. To the opposite side. Take your time. Listen to your body signal. Don't compete. Now, right foot comes, left foot comes next to the right knee. Everywhere I go, I get a compliment from everybody, all yoga teachers, yoga practitioners. You are doing. There is nothing called difficult asana. An asana is alignment, and it comes with relaxation. To difficult asana, and you are talking, you are singing, you are doing everything. So, again, right arm goes outside, left hand goes to the back, touching my right knee. And when you do that, be sure your muscles and everywhere. If you have many a time when you're doing this, your muscle may develop a little spasm. When the muscle tightens up, you'll feel the pain. What you need to do, you need to back off and need to do your breathing out longer than breathing in. Because all your carbon dioxide is going to come out and oxygen will come in, and oxygen is relaxant. Now, it's a little narrow space. Let me see. I want to show you the sun salutation for Vata, Pitta, and Kapha. Then we'll show you a few pranayama, the meditation, then we'll finish. Okay, we go all the way to the back, see how it's going to work. Don't have too much of a room here. They say this is not my house. So let me push the camera high up. You can sort of see me, but that's okay. Head is cut off a little bit. Okay, so a sun salutation for Vata. It will be very slow, very rhythmic, and gaze down. Because if you let the Vata, they will be looking all over. Okay, so first is your Pranayama, hands together. And you're doing with the breathing. Breathe out first. Take a slow deep breath in and hand raising high up, Hasta Uttanasana. Slowly take your hands down and do it a very slow and rhythmic way, no rush, nothing. Breathing out, put your hands all the way down.
Hand comes on the sides, then head comes towards your knee. Padahasta Asana. Left foot goes to the back, right knee comes in the front, chest opens up, look high up. Asana Sanchalan Asana. Right foot goes to the back, heel on the ground. You look towards your belly button. Parvatasana. Breathe in. You get into your Ashtanga Namaskar. Ashtanga means 8 points. 2 ankle, 2 knees, 2 hands. 6. Touch your chest first, then your chin next, and get down. Breathing in. Breathe out. Slowly get up into a cobra pose. Bhujangasana. Then go back to again Parvatasana. Heel on the ground. Look at your belly button. Left foot goes up in the front between your hand. All the pressure comes to the left knee. Look high up. Asta Sanchalanasana. Breathe out. Breathe in. The right foot comes to the front. Hand is on the ground. Hand is on the side. Slowly your head comes towards your knee. Padahastasana. Breathing in. Breathing out. Slowly you go back to the hand raising. Hasta Uttanasana. Breathing out. Then you breathe in. Hand comes in the front. So you started with the breathing out. You are finishing with the breathing in. 12 asanas. For the students, you have to memorize the name of all the asanas. And after 6th asana, 7th asana is a repeat. Prayer pose. Pranayama. Number 2, hand raising. Hasta Uttanasana. Number 3, head touching your knee. Padahasta Asana. Number 4, feet goes back, chest opens up. Asa Sanchalanasana, horse riding pose. Number 5, another foot goes back. Look at your belly button. Is your Parvatasana, mountain pose. Number 6 is a Ashtanga Namaskar, touching 8 points of your body. 2 feet, 2 knees, 2 hands, chest, and the forehead. Number 7 is a cobra pose, Bhujangasana. Now it goes back in the same cycle and back again. Number 8 is your Parvatasana. Both the feet high up, looking at your navel. So this starts the backwards again. Repeat. So after 7, all of them will repeat asana. Parvatasana, then you'll go to Asa Sanchalanasana, horse riding pose.
Then you go to Padahastasana, hand touching the ground and head touching your knee. Hastottanasana, hand raising high up. Then your Pranayama or a prayer pose is 12. 12 asanas. It repeats the 5 of them after 7. And if you start with the breathing in, it will end up with the breathing out. If you start with breathing out, it will stand with breathing in. For the Kapha people, they'll be doing little faster sun salutation. The one I showed it to you, very slow, very rhythmic for Vata people. For the Pitta people, it will be your moon salutation, Chandra Namaskar. Basically, it's the same steps as sun salutation, but the hitting poses are taken out. So it's the same practice. Let me go to the other side now. It will be your hands together, Pranayama. This time, let's start doing it your breathing in. Breathe out first. Take a deep breath in. Breathing out, hand goes high up, Hasta Uttanasana. And breathing in, slowly you come down and sit down like you're squatting pose. Take out the hitting component of your Padahastasana or a head touching your knee. Breathe out, you put your right foot out but support with your knee on the ground. So you're not creating the heat much. Raise your hands high up and drop your hands down and put your left foot to the back and both of them in the ground. Breathe in, hand goes high up. Breathe out, hand comes down, and you get into your on the ground like your Ashtang Namaskar. Then you get up into a Bhujangasana, the Cobra pose. Then you go back to your, like a child's pose, Bhuja Balasana. See, these are cooling asanas. Cooling asanas added to your Pitta practice. Breathe in, get your hands high up again. Breathe out, your left foot comes in, hands on the ground. Again, breathe in, hand is to the back. And breathe out, right foot comes in the front. This time your hand is in the front, hand is on the side, head comes towards your knee, Padahastasana. Breathe in, hand goes all the way to the back. And breathe out, comes to your Pranayama. So, yogis can do all of the practice anytime, anywhere, any place. For me, it doesn't matter. I'm in the train, I'm in the plane, wherever I am, I never miss my practice. Okay, all of you have a pranayama practice, and I have a whole YouTube. You can go to my YouTube. I have a multiple YouTube videos, pranayama for different diseases. Most important pranayama, as I told it to you, is the breathing out longer than breathing in.
Why? Lung has to be empty. Everybody says take a deep breath in. It's okay. Here I am. Here I am taking a deep breath in. It is sitting in the top of all my residual carbon dioxide. It is called a dead space. It is not doing any function for me. I will breathe out first. And take a deep breath in. Effortless. If you want to count, most of the Pitta people will count. Yes, fine. Count it effortlessly. For a Vata person, most important pranayama is your alternate nostril breathing. Generally, when you do practice pranayama, we do practice pranayama until we have any effort, and we practice the pranayama slowly and slowly increase your time. In a daily practice, we practice 1 hour, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. In alternate nostril breathing or Anulom Vilom Pranayama, left hand, we get a Gana Mudra or a Dhana Mudra, index finger touches the thumb. Right hand closes your right nostril. You don't have to close all the way down, just put underneath your nostril. Breathe out through your left nostril. Breathe in through your left nostril. Close your left nostril. Breathe out through your right nostril. Longer than breathing in. Breathe in through your right nostril. Breathe out through your left nostril. And you keep doing it, alternate nostril breathing. And I'll tell you the benefit of this breathing. Left nostril is controlled by the right brain. And also, I always practice with my eyes closed, so I get a more concentration on my breathing. Right brain is intuitive, right brain is female, right brain is cooling, right brain is parasympathetic. Left nostril breathing is cooling. It's called parasympathetic activation. Right nostril is controlled by the left brain. Left brain is analytical, left brain is male, left brain is heating, left brain is sympathetic. Right nostril breathing is heating, right nostril breathing is sympathetic. It is a sun energy called Vedhi Pranayama. Sun Pranayama. Left nostril breathing is called a Chandra Vedhi Pranayama or a moon Pranayama. Slowly you can concentrate because of the Vata, mind is still mobile. Take your index finger and middle finger, put it in your third eye, in between your eyebrows, and then take your left hand. This is called your balancing super brain yoga. Hold on to your right earlobe. Now you do the alternate nostril breathing with your eyes closed, focusing on your breath. It balances both sides of your brain. All the water-related diseases, water-related disorder, this is a primary therapy. All neuropsychiatric disorder, musculoskeletal disorders,
This is also very good to bring the focus back. So bring the memory back. People say, I'm losing my memory. Do alternate nostril breathing. Memory loss of focus will bring in both sides. But a mind is always very mobile. You need to quiet down the mind. In the mind, in yogic tradition, is the content of your five senses. I hear, I see, I smell, I taste, and I touch. Yoga says, quiet down your five senses. Control your five senses, called pratyahara. Pratyahara means reject. Ahara means your inputs. Reject your inputs. Create a vibration. The vibration is called your Brahmari Pranayama, bumblebee breathing. Wonderful practice for your vata balancing. Brain has a frequency. Bumblebee sound has a frequency. Two frequencies interact, cancels. It's a physics called harmonic resonance. Your mind quiets down. Then also for a vata practice, it's a meditation practice. We'll do an alternate nostril breathing without closing our nostril. That will be a meditative alternate nostril breathing for vata people. So let's do one, your bumblebee breathing. Brahmari Pranayama, we have seen so many times. I practice. Put your index finger in the forehead. Use three fingers to close your eyes. Use your both the thumb to close your ear. We also do a mudra called a Shanmukhi mudra. So you breathe out first. Take a deep breath in. Breathe out with the sound of a bumblebee. When you're doing this, you're totally in a transcendental state. Your body might move a little bit. You will never know. And I have a very classic when I'm doing it. I have a sometimes big class in front of me. If I take a picture of that, I'll see everybody is going in all different directions. If I do it 2 or 3 times, it follows with a very cooling practice called humming and cupping. You rub your hands. You rub your hands. When you feel the warmth in your hand, take both the hands like a cup. Put it over your eyes like a cup. Let the eyes take all the heat from your hand and massage your forehead, massage your eyes, massage your face. Remember, all the muscles in the face are attached to the skin. When the muscles are relaxed, all the frowning, all the lines in the body goes away. Take your hand, go behind your ear, in front of your ear, inside your ear canal. There's a branch called the auricular branch of the vagus nerve. It causes vagal stimulation and it's a parasympathetic activation. Bring your hands here, massage the carotid sinuses. The carotid sinus massage causes a profound parasympathetic activation, relaxation response. Hand goes to the back, massage the insertion of 2 muscles. It's called the trapezius and the sternomastoid muscle. Both are supplied by the cranial nerves, and as the cranial nerves get properly controlled. Chanting is a very powerful meditative practice for vata because the mind needs to quiet down. They're too busy. But they're very creative. They're busy, very creative. For a Pitta, most important pranayama is the left nostril breathing called Chandra Vedhi Pranayama. In a Chandra Vedhi Pranayama, what you do, you again use your left hand to do your Dhyana Mudra or Jnana Mudra. Close your right nostril. You will be breathe out through your left nostril, breathe in through your left nostril, and again all the breathing will be through your left nostril. Breathe out first through your left nostril. Breathe in through your left nostril. Breathe out through your left nostril. Another way you can do, you breathe in through the left nostril, breathe out through the right nostril, but do not breathe in through your right nostril. Example is, first let's start with the breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your left nostril. Breathe out through your right nostril. This is called Chandra Vedhi Pranayama. For Vata people, you will do right nostril breathing because Vata is cooling. Vata and Kapha, both their attributes is cooling. You will do through your right nostril breathing, which is your sun energy. Surya Vedhi Pranayama or sympathetic. All the breathing should be done through your nostril. We do not breathe through our mouth. If we breathe through our mouth, what happens? I don't know where the air has gone in. If I breathe through my nostril, when I breathe, I pay a little attention. I breathe out first through my nostril. When I breathe in through my nostril, my nose is like a filter. It filters all my air. It's like a personal air conditioner. Outside air is warm, it will cool down. If outside air is cool, it will warm up. See, I always change my foot when I'm sitting down in a cross-legged position. Air goes on the side of the nostril, which are called turbinate. It's like a groove. It generates like a vortex. When you measure the vortex behind the ear, by the nose, you'll be surprised. When it goes over the mucosa of your sinuses, releases a substance called a nitric oxide. Nitric oxide is a potent vasodilator and it is an activator of parasympathetic tone. Cyclic GMP, acetylcholine, nitric oxide, the mediator of parasympathetic tone. In the contrast, epinephrine and norepinephrine are the mediator of sympathetic tone. Slowly, the air goes into the larynx and all goes inside the lung. So through the nostril, we have a mechanism where all the air is directed towards your lung. It goes in the upper part behind your throat, upper part of the lung, middle part of the lung, lower part of the lung. If you breathe through your mouth, you don't know where the air has gone. It has gone to your stomach, gone to your lung. Somebody says, I have to breathe through my mouth. What you can do, You can breathe in through your nostril, breathe out first. Breathe in through your left nostril, breathe in through your both the nostril. Breathe out through your mouth. It's a lot more physiological. This question I get all the time, but we use your mouth breathing for doing your cooling in the body, called Sitali Pranayama and Sitkari Pranayama. In this pranayama practice, we are using mouth to cool down, but not to exchange air in us, not for the breathing. It is to cooling down our pitta. So the technique is, again, if you relax, you do the thumb inside and close. This is called your Balo Mushti Mudra, or a baby fist. Put it here. You stick your tongue out. Breathe out first. Breathe in through your mouth with your old tongue. Close your mouth. Breathe out through your nose. Within a short time, you'll feel a nice cooling inside. Somebody says, I cannot stick my tongue. You can do it through teeth. It's called Sitkari Pranayama. Put your tongue way high up. Any pranayama done through a nice, relaxed, cooling way is also effective, but primarily left nostril breathing, Chandra Vedhi Pranayama, Sitali, Sitkari. Another one you do through a teeth called a Sadanta Pranayama. But these are all cooling pranayama. Very good for people with the acid reflux, people with your inflammatory disease, heart disease, women with hot flushes. It's a wonderful practice. For the kapha, need energizing. So kapha will do as a Bastrika Pranayama. We'll do a Bastrika Pranayama slowly. For Vata, we'll be doing hand raising high up. And also breathe out first. Take a deep breath in and slowly pull it down. Breathe in. Breathe out. Breathe in. Breathe out. Vata will do eyes closed. Do it slowly. But for kapha needs the energy, needs to be your challenging, strengthening, stimulating, warming. So kapha will do like this. I can do a lot because, see, I'm still talking, I'm breathing, because I've been practicing every day. For you, you will do what your body will allow you to do. Very important concept. Also, you can do this Bastrika, very fast Bastrika. We always teach you to do a very slow Bastrika, but here you can do a very fast Bastrika with your being effortless. My hands in Adhi Mudra, take a look at it. I do it hundreds and hundreds and hundreds of them daily, but let me show you one small example so you'll understand what I'm talking about. Fast Bastrika. I did 200 of them. I'm still talking, breathing, totally effortless. Easily I can do 500 without any issue. My body is warm. I'm almost perspiring. All the airs are out. I breathe out first. Deep breath in. Way deep breath in. Kapalbhati Pranayama, as you've seen, you put the belly button in the back, you squeeze this balloon, it hits the diaphragm, lung is a balloon, air comes out. I've shown you the practice, it does with all the mudras, how it affects. There is another session, you can always look at into my YouTube channel and look, and we'll do another one, pranayama for different diseases. But for Bhastrika, what you do a rapid Kapalbhati Pranayama, like this. You can do an abdominal lock with the ani band. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. You can do Agnisar Kriya, which is very good for massaging all the abdominal organs, because abdominal organs are the organs which causes all the disease. Because remember, Udar Karshan, massaging your stomach, is a part of yoga therapy. Breathe out first. Take a deep breath in. Completely breathe out. This abdominal wall, which is massaging all the organs. For the meditation, you have to have your proper. So first important component meditation is keep your spine straight. In fact, the whole yoga practice is keep your spine straight. You do the Vajrasana, keep your spine straight. You're doing any sitting down. You also can sit down in a chair and do all the practice with your spine straight. Close your eyes, do a hand mudra, Jnana mudra or Dhyana mudra, and then for the Vata, what you will do, you will be the breath-centered meditation. Best way to do it is called meditative alternate nostril breathing. Close your eyes, bring your attention to your nostril. Visualize your left nostril with your eyes closed. Visualize you are breathing out through your left nostril. Visualize you are breathing in through the left nostril. Visualize you are breathing out through your right nostril. Breathing in through your right nostril. Breathe out through your left nostril. I can clearly see and I clearly do it without any effect. We do it in silence and slowly enter into a profound Vata balancing meditation. Let's do it about few just to show you the sample. Generally, when you do it, we do it for a little longer time. Initially, it sounds like almost impossible, but essentially, we'll see you'll be able to do it. So continue this for your Vata balancing. For Pitta balancing, because Pitta doesn't follow anybody, they follow their own self. So guide Pitta with their own consciousness. Pitta will do the same breathing through your nostril, but Pitta will focus on the heart. You'll be visualizing the breath as if I'm saying before, coming through your nostril. Nose is your personal air conditioner. Go through the turbinate. It creates a vortex. It releases nitric oxide from the mucosa. Then it goes in your larynx behind your throat, goes the upper part of the lung, middle part of the lung, lower part of the lung. It slowly comes down almost to the level of a belly button, and it stops there a little bit. Cable Kumbhak. Just wait for a short time and visualize your breath is coming from lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, through the nostril is coming out. Prana, the life force which resides outside, you visualize the breath is picking up the prana. Breath is not the prana. Metaphorically, if prana is the electricity, breath is like the electric cable. When you bring the prana inside, our whole body does breathing, not only lung. Our liver does a breathing, kidney does breathing, kidney does breathing. Then do a pranic healing. Visualize prana is coming to the organ of healing. My heart, I had a problem with my heart. I visualize the prana is coming to my heart. Somebody has a back pain, visualize prana is coming to your back pain, causing pranic healing. Diabetes, visualize prana is coming to your pancreas to cause your healing of your diabetes. Empty bowl meditation and the cable kumbhaka is your Pitta balancing meditation. For the kapha, it will be moving meditation. Like we stand up, it is called west rotation. Standing up, we put our hands, close your eyes, breathe out first. Take a deep breath in, slowly turn your hands all the way to the back and breathing out. The same breathing cycle, you come back into the middle. Take a deep breath in and go all the way to the back. This is called a moving meditation because for the kapha, if you don't move, do any movement, they like to be grounded. Walking meditation. When you're walking, I tell the kapha people, you don't have to close your eyes when you're walking, but pay attention to each step. So Pitta, on the other hand, what happens, since they're very dominant, very controlling the firing, they will count Every step, I tell them to have 100 steps, they will do, this is 100 steps, I came back. Kapha doesn't remember even, how many steps they have. Jyoti Tratak is another very nice. Tratak is your eye movement, because I remember eye is supplied by the 4 cranial nerves. Optic nerve, which supplies the retina, LO4 or SO4, LR6. There are muscles, superior oblique muscle, sometimes by the 4th cranial nerve. Lateral rectus muscle is supplied by 6th cranial nerve. Then the 5th nerve, trigeminal nerve, is also supplied. So 4 cranial nerves provide nerve supply to your eyes. Very important organ. Light a candle or light a flame and look at it without blinking. So many a time your water will come out through your eyes. See, blinking is both voluntary and involuntary. Summarizing all the asanas, grounding asanas below the belly button is your Vata balancing. All the asanas related to your belly button is your Pitta balancing. All the asanas are standing up like your mountain pose, tree pose, and all standing positions are your Kapha balancing asanas. Pranayama, Vata needs a guidance, so a breath-centered, Pranayama, Vata needs a alternate nostril breathing to balance both sides. Brahmari Pranayam, the bumblebee breathing, and also chanting, also Udgit Pranayam, Om Pranayam, Pranavo Pranayam. Pitta, all the asanas are at the belly button related asanas. Pranayama is your left nostril breathing or a Chandra Vedhi Pranayama. Sitali Pranayama, Sitkari Pranayama to cool down inside. Kapha, all the asanas are up, and Pitta meditation will be meditation with the breath centered and guidance from their self, looking inside their own heart. Kapha, all the asanas, in the uplifting asanas. Pranayama will be very fast, Bhastrika Pranayama, very fast, Kapalbhati Pranayama, Uddiyani Bandh, Abdominal Lock, Agni Sarkriya. And meditation will be your moving meditation, walking meditation, and your, say, Jyoti Tratak. Thank you. So these are balancing your doshas, Vata, Pitta, and Kapha, which is Ayurvedic Yoga Therapy. They're primarily related to our students who are joining today for our class. So for the students, we'll have a little bit of a break now and come back around 12 to start our class again. So I'll be here. Probably will join again on next Saturday for another class. Thank you.